A lot of people going through a lot of tough times, that's for sure, during this coronavirus outbreak. The guy we have with us on the line right now, his name is HL Greenberg, says he had the coronavirus back in December. Luckily, he's doing much better now, and we appreciate him taking the time to come on. Mr. Greenberg, thank you for being here. How are you?
Hi, I'm doing well. So my name is HL Greenberg. I'm a board-certified dermatologist. I actually did an internal medicine residency before dermatology. In my senior year of that residency at Georgetown Hospital, I did a rotation in infectious disease for a month with Dr. Anthony Fauci. So I'm very familiar with infectious disease and viruses. And when I didn't feel well in December, I wasn't sure what it was. I didn't feel well again in January. And it was either in December or January that I think I got the coronavirus.
What were your symptoms? And just tell us a little bit of what you had to go through there.
Sure. So in December, it was just general malaise around Christmas time, and I was in bed and achy. In January, and I coughed a little bit in December. In January, I went to a friend's. She asked me to take her daughter to a daddy-daughter dance. I went there on January 17th. That was in Henderson, and that was a Friday. And on Sunday, I wasn't feeling well. On Monday, which was Martin Luther King Day, I certainly wasn't feeling well. And on Tuesday, I spent all day in bed, and for the next week or two, I was coughing. I had fevers during the weekend and aches and pains.
Did you, obviously in December, we were, and even in January, nobody knew exactly how, the whole country was going to be shut down. But did you ever, any inkling, when was the first inkling that entered your mind with your, with your history and what that you said to yourself, holy cow, I might have the coronavirus? When did that first hit you?
Yeah, like everybody else, maybe not everybody else, I have a little brother, and he and I have a lot of debate, and we argue. And I told
Sounds like our radio show.
What's that?
So this sounds like our radio show every day. Go ahead,
yeah,
I'm sorry.
So, my brother likes to egg me on and give me a hard time, and I said, I had symptoms in January where I was coughing, I wasn't feeling well, and because Vegas is an international city, I think we were exposed before whatever the common narrative and timeline is. And he says, that's impossible. The timeline is what the timeline is. And I said, no, it's not impossible because this is a moving target. Nobody knows what's going on. So I ended up having, when the blood test came out in April, I was one of the first people to get it done. I had my blood collected on April 23rd, and on April 24th, I found out that I was SARS-CoV antibody IgG positive, meaning that I have been exposed, I didn't die, I made antibodies, and I am now immune to the virus.
Wow, that's incredible. And by the way, we're glad that you're doing much better than you and your family are well. You mentioned to me that you spent time, obviously, with Dr. Fauci. There's a lot. I have to ask you about that because, there are some people that are attacking Dr. Fauci, many on the right, and I don't want to make this political, but they are attacking his credibility. I've defended him. While he's not perfect, and even he says he's not perfect and he makes mistakes, I think he's a smart man and a good man. What can you tell us? You've spent time around Dr. Fauci. What can you tell us about him?
So I spent a month with him when I was in my senior year of Georgetown Hospital getting my internal medicine degree, and he was amazing. Everybody who was on that rotation wanted to present in a way not to embarrass themselves and to impress Dr. Fauci. And in fact, my father, when he was at Walter Reed Army Hospital, did his senior year rotation with Dr. Fauci, who was his fellow in infectious disease at the time. So I told Dr. Fauci, Dr. Fauci, my father was your senior resident at a point in time when he rotated here. And he said, son, you're making me feel really old. He's funny. He's bright. And I do think he has the best interest of medicine at heart.
When you think about that response team, right? Obviously, Dr. Fauci, Dr. Birx, Dr. Hahn, and the rest of them. What do you think about that whole dynamic, right? Where you're you want to focus on science, you want to focus on facts, right? But you're also, you have that balancing act where you're dealing with the Trump administration, right? You're dealing with politics. That's got to be something, right, that Dr. Fauci and the rest of them has to be tough to deal with, right?
I think it's tough, in this charged environment to deal with anything. And my brother and I share different political views, and none of these people are perfect, and they're all trying to do the best they can. But I can tell you that given my experience when I was with him, and it was during the time of HIV/AIDS, so we had a ton of HIV patients. It was all science-driven, fact-driven. But in this case, facts are changing. So the fact that I am, COVID-19 positive with my antibodies, mean that I was exposed and I don't have the disease, according to a timeline that shouldn't be means that the timeline has changed. Things have changed.
So where exactly did you get your antibody test done through? And so let's say someone wanted to do the exact same thing as you. How would they go about doing that? Was it Quest Diagnostics, or what was the company?
Yeah, so Quest is the one who offers the test. In my office, Las Vegas Dermatology, I had my blood drawn by my staff, and we sent it. And we're doing it for our patients. We have them fill out a questionnaire, and we do an office visit, discuss the implications of the test, and we just completed a one-pager on the test. I found out that we could offer the test basically April 21st. And I told my staff I was going to send out a newsletter, after I became positive, but I didn't want to send that out without having a process and procedure in place to draw the blood and to get it out. This test is not a good test if you think you are actively infected or if you've been infected within the past 3 weeks, because you wouldn't have had time to make the antibodies.
So as a dermatologist, I'm sure you have a lot of connections to hospitals and other doctors throughout Las Vegas. What have you heard about the virus actually being in hospitals? I mean, were the hospitals at any point overrun with people who actually have the virus, or that were overly symptomatic, or that were on ventilators? I mean, do you think that the virus really doesn't exist a lot in these hospitals? And what are your thoughts on the overall reaction, by the governor keeping Las Vegas in lockdown during this time? Do you think that it's warranted based on what you know?
Sure. So I'm Las Vegas Dermatologist in my practice is at Summerlin Hospital, so I have lunch at the hospital maybe every other day. But I've met with the CEO of the hospital, and when I thought that it was possible that I could still have the virus and be exposed, I asked him if I could have one of the ventilators, set aside for me, and he could get free dermatologic care for life. I just wanted one with my name on it, and they have not been using the ventilators. So they have like 99 ventilators, and they may have been using 20 or so. But those aren't necessarily COVID patients. These, a ventilator is used for multiple reasons, and COVID is just one of them.
I want to go back to Dr. Fauci because I find that fascinating. There's not a lot of people on the planet that have gotten a chance to learn from the doctor, to spend time around him, and even if you were only around him a month. What do you think to yourself when you see, for example, Fox News, for example? There are a lot of shows on Fox News. They go after the doctor. There are a lot of right-wing talk show hosts that criticize the doctor. In fact, they're criticizing him. I know a lot of he gave $3.7 million to the Wuhan lab. I know that's one theory where, and some people want to correlate the fact that maybe Fauci was a part of this. And other people want to say, well, Fauci knew the Clintons. He knew George Soros, So, yeah, I know. I laugh at it too, doctor, to be honest with you. I mean, you knew this guy. I mean, not extremely well, but you've spent time around this guy. Did he ever bring up politics in the discussion? Did he ever bring up how he used to hang out with the Clintons? What are your observations, and what goes through your mind when you see somebody on the right, like a Laura Ingraham, constantly attack Dr. Fauci?
I can tell you that when I spent time with him, I loved that man, and I thought he was just a model of the type of physician that I wanted to be. So I really enjoyed my time there with him. And, I was in touch with the dean of Georgetown's medical school on Twitter asking where I could donate my plasma if he had any connections. And it turns out that we can donate plasma here in Nevada through UHC, University Health Services, or UMC, that there's a program in place. But no, I've always been impressed with Dr. Fauci. And when people attack him, I don't – I think a lot of us have things that we're not proud of that we've done in the past, and I don't know what he's done or hasn't done. But when I worked with him, I thought he had a ton of integrity, and everybody around him was just impressed, and he was held in the highest of regard.
What would you do, doctor? And I know this isn't your forte, but let's just say hypothetically speaking, you're in that room where he's holding a press conference. You're Dr. Fauci or Dr. Birx, and the president looks at you and starts talking about the possibility of injecting disinfectants into your body. If you were put in that position, how would you react to that? What did you think of that whole spectacle?
I probably would have laughed too because it's so ridiculous. It's not, the president had said, and at least because I've been watching that too, and I see, all the political posts going around saying that now he's telling people to inject disinfectants and it's a bad idea. He said he was joking. Other people say he wasn't joking. I think when you're in a position such as that of the president, even when you're joking, it may not come across right. And I certainly told jokes in the room with patients, trying to lighten the mood and get them to feel more comfortable that have landed wrong. So I can't speak for him, but I think all of us can agree that you don't inject a disinfectant into a person.
Doctor, going back to what you discussed with JD regarding, medical capabilities and medical facilities capabilities here in Las Vegas and across Nevada, I just kind of wanted to bounce this off you because we are lay people here as radio hosts.
Sure.
You are an actual physician. In your opinion, and as far as your take, do you think that there's people out there, there's people like JD who think we should be open now and we should have opened, a couple weeks ago or maybe weeks ago, but there's also a lot of people out there that believe that we should have never shut down in the first place? Is there evidence out there? Are there facts out there that would support their argument to do those two actions?
Well, there's a couple points of view here. So up until maybe this week or even this weekend, we didn't even know if you were exposed that you have antibodies. Now, I knew, or antibodies that are protective and give you immunity.
Right.
Based on my training, I knew that if I have the disease, I don't die from it, I clear the disease, and I live, then I have antibodies.
Right.
Science doesn't change just because your political narrative is a certain political narrative. I don't know what the WHO is up to. I don't know what people with different agendas wanting to keep somebody like me who's had the disease, who I feel like I should have an immunity passport that I could wear on my chest and walk around without a mask. Now, I'm not going to do that because people don't understand it. I'm not going to disrespect others, and people are scared. I even had a patient say that he thinks I gave him the virus 2 days ago, even though I wear the mask and I don't have the ability to give it since I'm already immune.
Right.
Exactly. Yeah.
My personal opinion, I think that the whole city should open up, and that if you don't want to go out, you don't go out. That's my opinion.
Yeah, no, I agree.
And it would flatten the curve, not eliminate the disease. We still have HIV, and people are still being intimate. There are inherent risks with living a life, and in order for this city to survive, and I have a friend who just quit over with MGM because had mentioned to me, how are we going to, have a concert and only sell a quarter of the seats? How are we going to have a hockey game and only sell a quarter of the seats with social distancing? These things are impossible. There are risks of
you're
living,
right.
and either you risk it and you go live a life, or you stay in your home for the rest of your life. But it's not cure the disease. It's flatten the curve. I think we have the ability, and you don't get herd immunity unless you get the disease. Certain people have to get the disease.
Exactly. What do you think the actual mortality rate is based on what you know about antibodies? We've seen, it's been interesting. We've seen probably 10 or 12 different studies done across not just the United States, but also different countries that have come up with anywhere from a 0.15 to a 0.40. But then last week you had specific media outlets that were saying, and actually I think Chuck Schumer actually said too, that these antibody tests aren't really reliable. Based on the fact that you're saying that they are reliable, you actually had one. It showed that you had the virus and you're immune to it. What do you think the actual mortality rate is of this virus?
Well, I really don't know. Based on what I've read and what I've seen, and there's so much information out there, I really think that if you're obese, if you're older, if you have a comorbid condition, asthma, lung disease, if you have an autoimmune disorder, you may be at increased risk for getting the virus and not mounting as good of an immune response.
No question. Well, doctor, let me. I just wanted to say this. We're very happy that you and your family are doing well. We're happy that you've recovered from the coronavirus. Obviously, that's the most important thing. I'm sure it was a very dangerous time, or scary, I should say, time for you. We're glad you're back working again, and I appreciate the fact that you shared your story. And these are scary times that we're living in, but I appreciate your expertise, and I find it fascinating. There's not many people in the world that have gotten a chance to learn from Dr. Fauci. So I appreciate that about you as well. That's very unique, and I appreciate your candor with that. And thank you so much for taking some time to join us, Doctor. We really do appreciate it.
Yeah, well, thank you, and I really appreciate you guys, discussing this. And like I said, my brother lives actually in London, England, and there was a lot of debate there about how they're going to go about doing the coronavirus. And at first they wanted everybody to get it, and then they didn't want anybody to get it. And the prime minister there got it. We're all learning as we go.
Sure. No, I think that's the important thing. There's a lot of stuff we still don't know. And, my side has always been it's better to be on the side of caution when there are so many unanswered questions. Dr. Greenberg, really do appreciate your time again. And please be safe, and best to you and your family.
All right. Thanks, guys. Appreciate it. Take care.
Right.
Yeah, thanks a lot, Doc.
Interesting. I mean, he said that Dr. Fauci's brilliant. He never heard him talk about politics. Nothing but positive things to say about Dr. Fauci. And you know what? The majority of people have had that same sentiment when it comes to Dr. Fauci.